my name is Meehan, and this is my checkoff video number 4 for NUR 307 lab. I'm here with my Uncle Cass, who will be my pretend patient for this video. And in today's video, we're going to be assessing the heart and neck blood vessels. The first thing I want to go ahead and do is introduce myself to the patient, provide privacy, check doctor's orders, check that I have the correct patient, as well as perform hand hygiene. So I'll go ahead and get started. Hi, Mr. Meehan. My name is Meehan, and I'll be your student nurse today. I'm just going to check doctor's orders here and also identify that I have the correct person. I'm going to check your wristband here. Could you please confirm your full name and date of birth, please?
Castaldo Meehan, February 251966.
Perfect. Everything matches up, so I have the correct patient. From there, I'm going to go ahead and pull the curtain to provide privacy for the patient, as well as perform hand hygiene using soap and water. Next, I'll go ahead and assess the peripheral veins. The first thing I want to check is the jugular vein here, and I want to have the patient lying supine like I do now, and then from there I'll ask the patient to turn his head to the left so I can better see the jugular vein in his neck. All right, Mr. Meehan, if you could go ahead and please turn your head to the left, and then I'll take a look at the neck area and look for any movement from the jugular vein. Once I see movement from the jugular vein, I'm going to go ahead and elevate the patient's upper body. And since we don't have a mechanical bed, I'll just prop up the patient's upper body with pillows to bring it to a 45-degree angle. From there, I'm going to go ahead and take my rulers. I'll take the first ruler and place it on the sternum, specifically the angle of Lewis. And then I'll take my other ruler and mark and measure the distance from the jugular vein movement to the angle of Lewis, and then I will know if the measurements exceed 10 centimeters. I know that there will be some illness associated with that. Next, I'm going to go ahead and check the patient's hand veins here. So I'll have the patient lay his hand flat on a flat surface like he is now. I'm going to go ahead and palpate the hand veins to see if they are full, and they are. I'm going to see if the veins collapse when he raises his hand. So I'll ask the patient to please raise his hand, and I can see that the veins collapse upon raising them, and then I'll ask him to lower his hand back down, and the veins should fill back up. Next, I'll go ahead and check for I'll check the patient's extremities, notice if there's any pallor, any cyanosis, any varicose veins. I will also check for the Homan sign by asking the patient to dorsiflex his foot and ask if he feels any pain in his calf. So Mr. Meehan, if you could go ahead and dorsiflex your foot and then tell me if you feel any pain in your calf.
No pain.
And there is no pain in his calf, so that would indicate there's no deep vein thrombosis there. Once that is all done, I'll go ahead and assess the peripheral arteries of the patient. So there are 7 locations on the body where you can palpate an arterial pulse. The first part is in the neck, where you can find the carotid pulse. You can find the carotid pulse on each side of the neck, but to avoid cutting off circulation, we're only going to palpate the carotid pulse on one side of the neck. So I'll go ahead and palpate this side of the neck, and there is a carotid pulse there. Second place you would check for the second place you would check for an arterial pulse is in the inside area of the elbow area, and that is the brachial pulse. So you check here for a pulse. You'd also check the radial pulse, which is located on the thumb side of the wrist. To check the femoral pulse, you would check in the groin area. To check for the popliteal pulse, you would check on the inside area of the knee, behind the knee. To check the dorsalis pedis pulse, you would palpate the top of the foot. And then to palpate the posterior tibial pulse, that would be the inside of the heel area of the foot. Next, and as I'm palpating, I want to check for the heart rate. I want to check the rhythm. I want to check the the intensity. I also want to check for any abnormalities and bruits as well. I also want to listen for any bruits of the heart, and I'm going to listen to 5 specific areas of the heart using my stethoscope. So the first part I'm going to listen to with the diaphragm of my stethoscope is the aortic area, followed by the pulmonary, Erb's point, mitral, and tricuspid. And again, as I'm listening to these areas, I want to check for the heart rate, the heart rhythm, the intensity, any abnormalities as well. Last but not least, I will check for symmetry of the body, making sure each side is similar. I also want to check if there's any coolness to affected areas with the back of my hand. I also want to check for any muscle atrophy and any other abnormalities as well. From there, I'll go ahead and ask the patient if he has any questions and perform hand hygiene. All right, thank you, Mr. Meehan. We're all set. Do you have any questions for me at all?
No question.
All right, from there, I'll go ahead and open the curtain again and then perform hand hygiene using soap and water. And this concludes my video. Thanks for watching.